Hi everyone, my name's Craig McKenzie. I'm one of the pharmacists at Dunedin Hospital. So our aim for this was to reduce the harm, which we've chosen as nausea and vomiting, in our orthopaedic patients by 25% by March next year. We've chosen orthopaedic patients because that was a defined population. It's 2 wards and we had some good engagement clinically. So some of the interventions that we've tested, we've established a risk assessment sticker for post-operative nausea and vomiting. We've followed the information pathway and we feel that that's going to help with the information flow. You'll all be aware that people get asked the same question multiple times by multiple people and nothing ever seems to get done with that information. We've identified that as a potential problem with post-op nausea and vomiting. So there's, on our storyboard over there's the tool that we're planning to implement, and hopefully that documentation will flow with the patient. One of the things as we were talking to the wards, we've got 2 orthopaedic wards we're focusing this on. One of the wards said, "You took away our popsicles and they were brilliant." So the anecdotes from the nursing staff was that the popsicles post-operatively helped with the nausea and vomiting. So we've looked at that and they've been reintroduced. We've tested some protocol prescribing within Midchart. Some of the feedback from the nursing staff, we called them SPEW guidelines around antiemetics. They were stickers that were put into the drug chart, but with the advent of electronic prescribing, you don't have stickers stuck onto the computer screen and we can't pre-prescribe, so we'd lost that ability. So we're going back now to look at protocol prescribing within Midchart for our antiemetics. The last 2 here we haven't yet implemented because we're dependent on the services that own the documentation. They're doing a wee bit of an upgrade and we don't want to go introducing a change to then have another change pretty quick succession. So that's the introducing the anaesthetic pre-assessment post-op nausea and vomiting assessment tool, and then determining whether the score flows through each part of the process. So what's our data showing? We were collecting data using the ChatX data, which is data that goes off to the Health Round Table, and that comes from our coding, but the numbers there were very small. We were seeing points of percentages, maybe up as high as 2% for post-op nausea and vomiting attributed to opioids. So we were looking at other ways that we can capture that. We know when we went out and had our nursing staff talk to patients that we were seeing a rate of between 10, 12, 15%. And we've been able to now extract data out of Midchart so we can look at people who have had an opioid administered, who have had an antiemetic administered, and have had a combination administered. And we're starting to use that to use our run chart. So these are some of the information we've got out of Midchart. It goes back to June, but we've pulled data from the 1st of July. So one of our next plans is to go backwards to see whether just the ward staff know this project's underway, but they knew this project was underway earlier than the 1st of June. So we want to go back and just see whether the awareness has had any impact. So we can get data about patients who have received an opioid and then patients who have received both. We're making a wee bit of an assumption here that if people have received both an opioid and an antiemetic, it was because they were nauseated because of the opioid. So what are some of our key lessons and achievements? Data collection has to be sustainable, and we've struggled with that. Now we've got some Midchart extracts that will help, although it can be complicated. One of the key lessons for us is don't assume you know what will happen. We had this assumption that we'll just get everyone prescribed regular antiemetics and that's it, job done. Well, it's not hard, let's move on. But actually we learned that that could create further problems. So we've done a visual stream map to actually identify where is the particular problem, and we've gone right back to the very start. And I think one of the key things for us, as everyone's aware of, need to take time to understand what happens within that service and get the clinical buy-in and engagement to ensure you're going to have a sustainable change. Struggles for us, as everyone, resourcing. That's been a real challenge for us to be able to continue. Waiting on the clinical areas to implement changes. We know we've got an idea that we want to implement, but we can't do that because we're waiting on the other areas. and then getting the data from Midchart was a challenge. So some of our successes, the visual stream map allowed us to identify every stage in the process where there could be a problem. Identification of the standard assessment tool will hopefully overcome some of our challenges, and we have done a PDSA on where that information flows. And we've also had a poster accepted. One of our team members went back to the UK, she prepared a poster that's been accepted for presentation at the IHI conference in Florida in December. Thank you.